If you're a woman over 60 and you love adding this popular vegetable to your salads, you need to hear this right now. What I'm about to share could explain why those bulging veins in your legs have been getting progressively worse, despite everything you've tried. I've seen this pattern in my clinic so many times that I can't stay silent anymore. My name is Dr. Emily Hartwell, and I'm a vascular medicine specialist with over 20 years of experience treating venous disorders. Throughout my career, I've worked with thousands of patients struggling with varicose veins, and what I've discovered about dietary influences on vein health has been absolutely eye-opening. Before we dive in, if you haven't subscribed yet, I recommend hitting that button and turning on notifications so you never miss another health tip made especially for you. If you enjoy this video, please send video suggestions and your questions in the comments. I read every single one, and it helps me create more content to help people just like you. Let me tell you about Mrs. Patricia Hensley, a 68-year-old retired librarian from Charleston. Patricia came to my office 3 years ago, absolutely devastated. She had been an avid gardener her entire life, someone who took pride in staying active and eating what she called a perfectly healthy diet. But over the past 18 months, her varicose veins had become so severe that she could barely stand for more than 20 minutes without experiencing intense pain and swelling. What broke my heart was when she told me she'd given up her beloved garden club because she was embarrassed by the appearance of her legs. Patricia had tried compression stockings, elevation, even expensive topical treatments, but nothing seemed to help. When we sat down to review her complete medical history and daily routine, including her diet, something immediately caught my attention. Patricia was consuming large amounts of raw tomatoes every single day, sometimes eating 3 or 4 medium tomatoes in her salads alone. She thought she was doing something wonderful for her health, and in many ways, she was. But what she didn't know was how this habit was potentially sabotaging her vein health. Here's what most people don't understand about varicose veins and nutrition. We often focus on exercise, weight management, and genetics, but we rarely discuss how certain foods can influence venous pressure and inflammation in ways that either help or harm our vascular system. Varicose veins occur when the valves in our veins weaken and fail to push blood back up to the heart effectively. This causes blood to pool, creating those twisted, bulging veins we see on the surface. While tomatoes are incredibly nutritious and packed with antioxidants like lycopene, they also contain high levels of natural compounds called salicylates and a significant amount of tyramine. In certain individuals, especially postmenopausal women with existing venous insufficiency, these compounds can trigger inflammatory responses and affect blood vessel tone in unexpected ways. The connection isn't about tomatoes being inherently dangerous. It's about understanding individual responses and consumption patterns. When someone like Patricia consumes excessive amounts daily, particularly raw tomatoes which have higher concentrations of these compounds, it can contribute to increased vascular inflammation and fluid retention. These effects are subtle at first, but over months and years, they can exacerbate existing venous problems. The tyramine in tomatoes can also affect blood pressure regulation in some people, and any significant fluctuations in blood pressure can put additional stress on already weakened vein walls. If you're still watching and finding this information helpful, comment a heart below to show you're with me. This is important because so many women are suffering unnecessarily without knowing there might be simple dietary adjustments that could make a real difference. Let me share another case that really illustrates this point. Mrs. Dorothy Kim, a 72-year-old former accountant from Portland, had been dealing with progressively worsening varicose veins for nearly 5 years. Dorothy was meticulous about her health. She walked 4 times a week, maintained a healthy weight, wore compression stockings religiously, and had even undergone 1 round of sclerotherapy treatment 3 years prior. Yet her symptoms kept returning, and new varicose veins kept appearing. She described constant achiness in her calves, night cramps that woke her up, and a heavy, tired feeling in her legs that made even simple activities exhausting. When Dorothy came to see me, she was frustrated and confused. She'd done everything her previous doctors recommended, so why wasn't she getting better? As we went through her dietary habits, I learned that Dorothy had become passionate about making homemade salsa and tomato-based vegetable juice after reading about the cardiovascular benefits of lycopene. She was consuming the equivalent of 6 to 8 tomatoes daily through various preparations. While her intention was admirable, her body was reacting poorly to this concentration of certain compounds. What happens at a physiological level is fascinating and complex. Tomatoes contain natural histamine and can also trigger histamine release in some people's bodies. Histamine is a chemical that plays a crucial role in our immune response, but it also causes blood vessels to dilate and become more permeable. For someone with healthy, strong veins, this isn't typically a problem. But for women over 60 who already have compromised venous valves and weakened vein walls, this additional dilation can worsen the pooling of blood and increase the visibility and discomfort of varicose veins. The situation is often compounded by the fact that estrogen levels drop significantly after menopause, and estrogen plays an important protective role in maintaining vein elasticity and strength. Without adequate estrogen, vein walls become less resilient, and any additional stress, including dietary inflammation, has a more pronounced effect. But here's what really surprised me during my years of practice. When I suggested that Patricia reduce her tomato intake significantly for 3 months as part of a comprehensive approach to managing her varicose veins, she was skeptical. She worried about losing the nutritional benefits, particularly the lycopene and vitamin C. I assured her we could find alternative sources for these nutrients, and I emphasized that this wasn't about eliminating tomatoes forever, but about identifying whether they were contributing to her specific symptoms. We also implemented other strategies including targeted exercises, proper hydration, anti-inflammatory foods like berries and leafy greens, and continued use of medical-grade compression stockings. After just 6 weeks, Patricia called my office almost in tears, but this time from relief and joy. The constant aching in her legs had decreased by what she estimated was 60%. The swelling that used to make her ankles disappear by evening was noticeably better. She still had varicose veins. The existing ones don't just vanish, but they were less inflamed, less painful, and the progression had clearly slowed. Now, let me be absolutely clear about something crucial. I'm not telling you that tomatoes are bad, or that everyone with varicose veins should avoid them completely. Tomatoes have incredible health benefits. They're associated with reduced risk of certain cancers, they support heart health, they provide important nutrients. What I am saying is that for some women, particularly those over 60 with existing varicose veins or venous insufficiency, consuming large amounts of raw tomatoes daily might be contributing to inflammation and symptoms. The key is awareness and individualization. Let's talk about Mrs. Helen Rodriguez, a 65-year-old retired teacher from Miami, who had a slightly different experience. Helen had moderate varicose veins and was also consuming significant amounts of tomatoes, primarily in the form of caprese salads and fresh tomato sandwiches, which she ate almost daily. Unlike Patricia and Dorothy, when Helen reduced her tomato intake, she didn't notice dramatic improvements in her vein symptoms initially. But what she did notice was that her legs felt less heavy and swollen, especially during Florida's humid summer months. This taught me an important lesson. The impact of dietary factors on varicose veins isn't uniform. Some women are more sensitive to the compounds in tomatoes, while others might be affected more by different foods entirely. Helen's story also reminded me that varicose vein management is multifactorial. We eventually discovered that Helen's biggest dietary culprit was actually excessive salt intake, which was causing significant fluid retention and putting extra pressure on her venous system. The science behind food sensitivities and vascular health is still evolving, but here's what we know with reasonable certainty. Certain foods can promote inflammation throughout the body, including in blood vessel walls. When someone has pre-existing vascular weakness, such as incompetent venous valves, chronic inflammation can accelerate deterioration and worsen symptoms. Tomatoes, particularly in large quantities, can be problematic for some individuals due to their salicylate content, their effect on histamine levels, and their tyramine content. Other foods that can have similar effects include aged cheeses, fermented products, processed meats, and foods high in refined sugars. Conversely, foods rich in flavonoids like citrus fruits, berries, and dark leafy greens can actually strengthen vein walls and reduce inflammation. If this information is resonating with you, remember that small changes can make a big difference. You don't need to overhaul your entire diet overnight. Start by being mindful of how much of certain foods you're consuming and whether you notice any correlation with your symptoms. Here's another critical aspect that many people overlook. The way tomatoes are prepared can influence how your body reacts to them. Cooked tomatoes, like those in tomato sauce or soup, have different properties than raw tomatoes. The cooking process can reduce certain compounds while making others, like lycopene, more bioavailable. Some of my patients have found that they tolerate cooked tomato products much better than raw ones. Mrs. Angela Foster, a 70-year-old former nurse from Seattle, discovered this through trial and error. She loved tomatoes too much to give them up entirely, so we experimented with her diet. She found that she could enjoy moderate amounts of tomato sauce or roasted tomatoes without experiencing the leg heaviness and increased vein visibility that raw tomatoes seemed to trigger for her. This allowed her to maintain some of the foods she loved while still managing her symptoms effectively. The connection between diet and vein health extends beyond just tomatoes. I want you to understand the bigger picture, because knowledge is power when it comes to managing chronic conditions. Your venous system is under constant pressure, literally. When you stand or sit for long periods, gravity makes it harder for blood to flow back up from your legs to your heart. This is why people with venous insufficiency often feel worse at the end of the day. Anything that increases inflammation, causes fluid retention, or affects blood pressure can make this situation worse. High-sodium foods cause you to retain water, which increases blood volume and puts more pressure on your veins. Foods high in refined sugars can spike your blood sugar and promote inflammation throughout your cardiovascular system. Trans fats and excessive saturated fats can affect blood viscosity and contribute to poor circulation. On the flip side, foods rich in antioxidants, fiber, and specific nutrients like vitamin C, vitamin E, and rutin can support vein health and potentially slow the progression of varicose veins. Let me tell you about Mrs. Barbara Newsom, a 69-year-old retired postal worker from Denver who came to me with a unique perspective. Barbara had been researching varicose veins extensively online and had come across conflicting information about diet. One source told her to eat lots of tomatoes for cardiovascular health, another suggested avoiding them for inflammation. She felt paralyzed by all the contradictory advice and didn't know what to do. This is such a common problem in today's information age. Everyone has access to medical information, but context and individual application are often missing. What I explained to Barbara, and what I want you to understand, is that medicine is rarely about absolute rules. It's about understanding principles and then applying them to your unique situation. Yes, tomatoes are generally healthy. Yes, they can also be problematic for some people in certain quantities. The question isn't whether tomatoes are good or bad, it's whether they're right for you in the amounts you're consuming them, given your specific health conditions. Barbara and I developed a systematic approach. We kept a detailed symptom diary for 4 weeks while she continued her normal diet, noting the severity of her leg pain, swelling, and heaviness each day, along with everything she ate. Then, for the next 4 weeks, she eliminated tomatoes completely while keeping everything else as consistent as possible. The pattern that emerged was striking. On her regular diet, Barbara averaged a pain level of 6 out of 10 by evening. During the elimination period, her average dropped to about 3 out of 10. We then reintroduced tomatoes in small amounts, first cooked and then raw. The raw tomatoes clearly correlated with increased symptoms within 48 hours, while moderate amounts of cooked tomatoes seemed fine. This gave Barbara clear guidance for her diet going forward. She didn't have to give up tomato-based foods entirely. but she learned to limit raw tomatoes and pay attention to her body's signals. The emotional impact of varicose veins is something I can't stress enough. It's not just about physical discomfort, although that's certainly significant. It's about how women feel about themselves, their confidence, their willingness to engage in activities they love. Mrs. Carolyn Matthews, a 63-year-old former dancer from New Orleans, came to me in tears during her first appointment. She told me she hadn't worn a dress or skirt in over 3 years because she was so self-conscious about her legs. She'd stopped going to her weekly dance class, something that had been a source of joy and social connection for decades. The varicose veins had stolen more than just her comfort. They'd stolen part of her identity. As we worked together on a comprehensive management plan that included dietary modifications, targeted exercises, and eventually some minimally invasive procedures, Carolyn's improvement was remarkable. But what she told me that meant the most wasn't just the physical changes. It was that she felt empowered again, like she had some control over her condition rather than being a helpless victim to it. This brings me to an important point about taking action. If you're dealing with varicose veins, especially if they're progressing or causing significant symptoms, you deserve comprehensive care. That means working with a healthcare provider who looks at all the factors, not just one aspect. Dietary changes can be incredibly helpful, but they're rarely a complete solution on their own. You might also benefit from compression therapy, specific exercises to improve calf muscle pump function, leg elevation techniques, adequate hydration, maintaining a healthy weight, and in some cases, medical interventions like sclerotherapy or endovenous laser treatment. The key is addressing your situation holistically. Now, let's talk about what you can do starting today. If you consume tomatoes regularly and you have varicose veins, consider this a gentle experiment rather than a rigid rule. For the next 3 to 4 weeks, try reducing your tomato intake significantly, especially raw tomatoes. Keep track of your symptoms. Do your legs feel less heavy? Is the swelling better? Are the aching and discomfort reduced? Pay attention to how you feel. If you notice improvements, you've discovered something valuable about your body. If you don't notice much difference, then tomatoes probably aren't a major factor for you, and you might need to look at other dietary elements like salt intake, sugar consumption, or inflammatory foods. Either way, you're learning and taking active steps to manage your health. Replace some of those tomatoes with other nutrient-rich foods that support vein health. Blueberries, blackberries, and cherries are excellent choices. They're packed with anthocyanins that strengthen blood vessel walls. Citrus fruits provide vitamin C and bioflavonoids, both crucial for collagen production and vein integrity. Dark leafy greens like spinach and kale offer vitamin K, which supports healthy blood clotting and vascular function. Nuts and seeds provide vitamin E, an antioxidant that protects blood vessels from damage. Fatty fish like salmon offers omega-3 fatty acids that reduce inflammation throughout the body. You're not sacrificing nutrition by reducing tomatoes. You're simply diversifying your sources of important nutrients. Stay well hydrated throughout the day. Dehydration makes your blood thicker and more difficult to pump back up from your legs. Aim for at least 8 glasses of water daily, more if you're active or live in a hot climate. Reduce your sodium intake, which often means cutting back on processed foods, canned soups, deli meats, and restaurant meals that tend to be very high in salt. Move regularly throughout the day. If you sit for work, set a timer to stand and walk for a few minutes every hour. If you stand for work, try to sit and elevate your legs during breaks. Simple calf raises, where you rise up on your toes and lower back down, can be done anywhere and help activate the muscle pump that pushes blood back toward your heart. Consider investing in medical-grade compression stockings if you haven't already. They're not the same as regular support hose. They provide graduated compression that's strongest at the ankle and gradually decreases up the leg. This helps counteract the pooling of blood. Yes, they can be challenging to put on, especially if you have arthritis or limited flexibility, but there are devices available that can help. The relief they provide is usually worth the effort. Mrs. Jennifer Lawson, a 71-year-old retired pharmacist from Boston, told me something profound during one of her follow-up visits. She said that dealing with her varicose veins had taught her an important lesson about aging and health management. She realized that she couldn't approach her health the same way she did when she was 40 or even 50. Her body had different needs now, different vulnerabilities, and that wasn't a failure on her part, it was just reality. Once she accepted that and started working with her body instead of against it, making adjustments like moderating her tomato intake and being more intentional about movement and compression, everything became more manageable. She still had varicose veins, but they didn't control her life anymore. I want to emphasize something crucial before we wrap up. Nothing I've shared today should replace personalized medical advice from your healthcare provider. If you have severe varicose veins, ulcers on your legs, significant swelling, or pain that interferes with daily activities, you need a thorough evaluation. These could be signs of more serious venous insufficiency or even blood clots, which require prompt medical attention. What I've offered today is educational information to help you have more informed conversations with your doctor and to empower you with knowledge about potential dietary factors that might be influencing your symptoms. The relationship between what we eat and how our vascular system functions is complex and highly individual. Some women will notice dramatic improvements from dietary changes. Others will find that exercise and compression make the biggest difference, and many will benefit from a combination of approaches. There's no one-size-fits-all solution, and that's okay. What matters is that you're informed, proactive, and willing to work with your body to find what helps you feel your best. As we close, I want you to remember that having varicose veins doesn't mean you've done something wrong or that you're somehow failing at taking care of yourself. For most women, varicose veins are primarily the result of genetics, hormonal changes, and the natural aging process. Yes, certain factors like prolonged standing, pregnancy history, and lifestyle choices play a role, but even women who do everything right can develop them. What you can control is how you respond and how you manage your symptoms. Every small positive change you make, whether it's adjusting your diet, moving more, staying hydrated, or wearing compression stockings, contributes to your overall vein health and quality of life. If you found this information valuable, please share this video with other women who might benefit from it. Leave a comment telling me about your experience with varicose veins and whether you've noticed any dietary connections. Your insights could help someone else who's struggling. And remember, taking care of your vascular health is a form of self-respect and self-care. You deserve to feel comfortable in your body and to have the energy and mobility to do the things you love. Don't let varicose veins rob you of that. With the right information, consistent effort, and professional guidance when needed, you can manage your symptoms and prevent progression. Thank you for watching, and I'll see you in the next video where we'll discuss more ways to support your health naturally and effectively.